Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 30th, 2025. This video is an open access article in JACC, Journal of the American College of Cardiology, published yesterday, 29 September 2025. It's an ACC scientific statement titled Inflammation and Cardiovascular Disease, a report of the American College of Cardiology. The authors include Dr. George Manson, Dr. Natalie Arnold, Dr. Sumant Prabhu, Dr. Paul Ritker, and Dr. Francine Welty. What is residual inflammatory risk? It refers to persistent elevated cardiovascular risk from chronic low-grade inflammation despite optimal control of traditional risk factors such as elevated cholesterol and high blood pressure, measured commonly by hsCRP or high sensitivity C-reactive protein. Why is hsCRP important in cardiovascular risk? hsCRP is a strong independent predictor of recurrent cardiovascular events and is useful in both primary and secondary prevention. Which anti-inflammatory therapy has proven benefit? Low-dose colchicine has demonstrated significant benefit in reducing recurrent cardiovascular events and is FDA-approved for this indication. What lifestyle changes reduce inflammation? Adopting a Mediterranean or DASH diet, engaging in regular exercise, quitting smoking, and maintaining a healthy weight significantly reduce the inflammatory burden. What imaging markers are used for inflammation? Perivascular fat attenuation index and other vascular imaging modalities are promising but currently remain research tools and are not yet recommended for routine practice. How does inflammation contribute to atherosclerosis? Inflammation drives endothelial dysfunction, leukocyte infiltration, foam cell formation, and plaque rupture, which are key steps in atherogenesis. What roles do omega-3 fatty acids play? EPA and DHA reduce cardiovascular risk, lower systemic inflammation, and generate specialized pro-resolving mediators that promote resolution of inflammation. Is hsCRP useful in apparently healthy individuals? Yes. Elevated hsCRP identifies higher risk individuals in whom statins reduce first major cardiovascular events, even when LDL cholesterol is normal. Which patient groups benefit from colchicine? Those with chronic stable atherosclerosis benefit the most. Colchicine is less effective when started in acute ischemic settings. What are the gaps in evidence? Uncertainty remains around targeting inflammation in atherosclerotic cardiovascular disease-free populations, the role of novel biomarkers, and the long-term safety of immunomodulatory agents. How is inflammation linked to heart failure? Chronic low-grade inflammation contributes to tissue remodeling, cardiac arrhythmias, and progression of heart failure. Elevated hsCRP and IL-6 are strong predictors of poor outcomes. What is cardioimmunology? It is an interdisciplinary field studying interactions between immune responses and cardiovascular function, identifying immune-driven mechanisms of disease. Do statins help in heart failure? Statins may benefit older patients with ischemic heart failure, but have not shown consistent mortality benefit across all populations. What roles do omega-3 fatty acids play in heart failure? EPA plus DHA supplementation modestly reduces mortality and hospitalizations in patients with NYHA class 2 to 4 heart failure. What emerging therapies are being studied in HFpEF? IL-6 inhibitors such as ziltivekimab are under trial for reducing inflammation and improving outcomes in heart failure with preserved ejection fraction. How is recurrent pericarditis treated? First-line therapy includes NSAIDs and colchicine. For resistant cases, IL-1 blockade, anakinra, rilonacept is highly effective. When should IL-1 blockade be considered in pericarditis? It is considered in patients with multiple recurrences resistant to colchicine and steroids and when hsCRP is about 10 milligrams per liter, provided TB is excluded. Why is colchicine important in pericarditis? Colchicine reduces recurrence rates significantly and is recommended adjunct therapy for acute pericarditis. What are the limitations of steroid use in pericarditis? Steroids may control the symptoms but increases the recurrence risk. Thus, they are reserved for refractory or specific cases. What new therapies are in development for pericarditis? Novel IL-1 inhibitors such as goflicizumab show promising results in preventing recurrences in high-risk patients. What dietary patterns reduce inflammation? The Mediterranean and DASH diets, rich in fruits, vegetables, nuts, olive oil, and oily fish, lower inflammation and cardiovascular risk. How does exercise impact inflammation? Regular physical activity lowers CRP, improves endothelial function, increases specialized pro-resolving mediators, and reduces cardiovascular events. What's the role of smoking in inflammation? Smoking amplifies pro-inflammatory cytokines and suppresses resolution pathways, markedly increasing cardiovascular risk. How does obesity contribute to inflammation? Adipose tissue releases cytokines that drive systemic inflammation, raising cardiovascular disease risk and worsening outcomes. Can omega-3 supplementation pose risk? High doses, greater than 1 gram per day, of marine omega-3 may increase the risk of atrial fibrillation despite cardiovascular benefits at moderate doses. In addition, fish oil increases LDL cholesterol. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.